Anthony. I'm CEO of the National League of Cities, and I want to thank you all for joining us. Before we begin, just a quick note on housekeeping for journalists who have joined us and have a question. Please put your name and outlet in the chat box space there and raise your hand, and we'll have time to address your questions at the end. You know, this is an important day. Because it is a critical time in our nation that we, in fact, have marked a grim milestone this week, surpassing over 500,000 COVID-19 deaths in America, which is signaling that it is more important than ever to raise our collective voices to help combat this horrible virus that has impacted our nation. Today, 6 CEOs of nation's largest associations and nonprofit organizations in America are here to talk about an issue that matters, an issue that cannot be ignored, an issue that is close to all of us, and that is the vaccine and the impact that it's having on our nation, but more specifically, the Black community. We are CEOs representing organizations that combined with a combined reach of tens of millions of people across our country. We reach the smallest of towns, the largest of cities, from youngest generation to those in our greatest generation, professional associations. In one way or another, this group touches nearly every corner and every resident in the United States of America. I'm really proud to be part of this group of organizations who are calling for a stronger America, one where we believe in promoting education and equitable vaccine access. Our collective voices have power. This pandemic has significantly ravaged the Black community. However, it is based upon some historical facts that we will talk about as the presenters today speak. This is why we're here today. And that is why author Joanne, Kevin, Tracy, and Mark, and myself, we're here to raise our voices to uplift the importance of the vaccine and the equity associated with it, and to showcase accurate information, which is so important about COVID-19 and the vaccine. It's about the facts that we want to talk about here today. Black Americans have nearly 3 times higher risk of hospitalization and 2 times risk of death from COVID-19. You know, that is unacceptable. In addition, we start thinking about the long-term impact that data is going to have on the Black community and people of color generally. Each of us are here to say how important it is that we don't continue to see this disproportionate impact of this pandemic on our communities. As Black CEOs and CEOs of organizations who've been leading and sharing information to our members on responding to this pandemic, we are concerned that Black Americans are being vaccinated at rates 2 times or 3 times, in some cases, more than other people, especially our white community. So today, we say that we must talk about the facts. We must learn about the facts as it relates to the vaccine. You know, I've gone myself over a journey of skepticism about the vaccine, but I've relied on guidance and information from scientists, leaders in the medical community, as well as public health officials who have helped me to change my thinking. But more importantly, it was about getting that information out there. So as the National League of Cities, I want to make sure that our 19,000 cities, towns, and villages who have mayors and council members, that they get the information and they learn how to help get the vaccine out equitably, as well as administered in a way that access is there. So we continue to educate our members, and we are in a unique moment to speak directly to Black communities about the importance of our nation's vaccine effort and to ensure they have tools to break down those historic barriers that have left Black Americans behind in the past. It is critical to NLC and each of our organizations that we overcome long-standing health and economic disparities to uplift the Black community, enable them to access information that is important, and to the vaccine rollout. I'm honored now to turn it over to Joanne Jenkins, the CEO of AARP. Welcome, Joanne.
Thank you, and good morning, everyone. And thank you, Clarence, for pulling all of us together. You know, the impact of COVID-19 on the Black community has been devastating. We know that this level of execution and rollout of the vaccine is completely unacceptable. When we think about the over 500,000 people who have died, 90% of those have been over the age of 50. And 40% of those have lived in nursing homes or either worked in nursing homes. And we all know that the Black and brown community are the largest number of people who work in those type of facilities. And so we know that we need to do something to make sure that we are stopping the number of deaths and also the number of people who are being hospitalized. That is key to us overcoming these devastating effects of COVID-19. Earlier this week, we heard from the CDC that the average life expectancy had fell for the first time in many, many years by 1.5 years. But more so for the Black community, it fell 2.7 years. And so moving life expectancy from 74.7 to 72 years of age. And so we know that the equity in the distribution of the vaccine is key to serving people in the Black and brown community all across this country. And we hear from our 38 million members at AARP that they're frustrated. They're frustrated about getting information. They're frustrated about how they learn where they need to go get their vaccine. They're frustrated about the lack of information they have to determine for themselves whether or not they ought to be vaccinated. And so a lot of the work that we've been doing at AARP has been around trying to make sure that the vaccination is free, that people have the information they need about the vaccine, that we're continuing to advocate, as Clarence said, at the state, local, and national levels to work with those elected officials to make sure that the vaccine is available and equitable. We know that less than 5% of Black Americans have actually received the vaccine. And so we need to make sure that we are putting those vaccination hubs in places that serves people of color, because we know that they're the ones most likely to be affected by health disparities all across this country. And at AARP, one of the things that we've been trying to is to make sure that our website at aarp.org is updated every day with state information that's available so that we can make it as easy and transparent as for people to learn about the vaccination process, to learn where they need to go, and to be able to look at those and make those decisions for themselves as they go through this cumbersome process. We've also been strikingly surprised by the lack of coordination and thinking about looking for ways that people who may not have access to the internet can sign up. And so we've been advocating with governors and mayors all across this country to make sure that they have simple 1-800 numbers, that they have assistance in helping to get people to vaccination sites, and that they're thinking about those, particularly Black and brown communities, who may not be able to get to a vaccination site. And so we're very concerned, we're advocating, we're trying to make sure that people are, elected officials are looking at these equity issues as they affect the Black community. And we are happy to engage with our colleagues here today in seeing how collectively we we can bring the power and the voice of all of our nonprofits to this space to be able to help, particularly the Black community and the Brown communities all across this country. And so with that, I'd like to turn it over to my colleague, Tracy Brown, who is the head of the American Diabetes Association.
Good morning. Thank you, Joanne. Thank you, Clarence, for bringing us all together. As Joanne said, I'm the CEO of the American Diabetes Association, representing 122 million people who are living with diabetes and prediabetes. In fact, I am actually one of the 34 million people who are living with diabetes. And so I personally know that diabetes was an epidemic in this country before the pandemic. When you think about the fact that 1 out of 2 people in this country are living with prediabetes or diabetes, that every 2 minutes, somebody's having a stroke because of diabetes and its complications, every 4 minutes, somebody's losing a limb, and every 10 minutes, somebody's having kidney failure. That was all before the pandemic. When you overlay COVID-19 on top of that, you start to understand that you are now 2 times likely to have an amputation, 6 times as likely to end up in the hospital, 12 times as likely to actually die from COVID-19 with diabetes. And if you look at the deaths from COVID-19, 40% of those who have died are people living with diabetes. Now, if that wasn't enough, what also COVID-19 exposed is the inequities. So when you overlay the inequities on top of all of those things, it gets even worse, with Asians dying 1 times as more, indigenous people 2.5 times as more, Black people 2 times as more, Latinx 2 times as more. The numbers get worse. And so this issue that has brought all of us here today is critical. Everyone needs to have the access to this vaccine. Everyone actually needs to have access and the right to good health, because that's a human right. And so when you look at the numbers, as Joanne has indicated, only 5% of the vaccine distribution has been for Black Americans. That's not okay. 35%, the latest survey that I said is only 35% of Black Americans have even said they have taken or would take the vaccine. That's another issue. And so that's why we have leaned in with the other CEOs and other organizations. We've launched our Health Equity Now platform, because we've got to lean in together to make sure that we are getting the vaccine to the places that need the vaccine, that we continue to work to make sure that you can affordably get everything that you need as a person living with diabetes. We know that 1 in 4 people right now during this COVID-19 pandemic are rationing their insulin and other medication. Again, that's not okay. We know that we've got to continue to advocate at the state and local level. We've got to make sure that there is access to quality care. We've got to make sure that we're actually getting into communities. And that's where we work with our 500,000 advocates that are on the ground to drive forward these things. So personally, I do support the vaccine. As a person living with diabetes, we have advocated that diabetes be in that priority a line to get the vaccine. I have signed up, I am in line, and when my time has come, I will take the vaccine. But I am also quite aware that far too long, the health of Black Americans and people of color has gone ignored and even abused. And this is why the education and the data is so important. And as Clarence mentioned in the opening, I too am looking at reading and talking to the doctors, the scientists, reading as much information so that I understand the facts. And here's what we know. Yes, this vaccine was developed very quickly, but that's because technology has advanced. We know that scientists from all over the world, all multi-racial backgrounds and disciplines were involved in the development of the vaccine. We know that people of color have served on the review panels with the FDA. We know that people of color were involved in the clinical trials, albeit we need more, but they were involved. And so we have to weigh the risks of taking the vaccine versus not taking the vaccine. And again, when I look at the numbers, with a person living with diabetes being 12 times likely to die, and then when you add a person of color on top of that, it gets worse, I definitely am going to get the vaccine. And I want to encourage the continuing working together so that we can get the right information out there. We don't need to let COVID-19 continue. As Joanne said, the life expectancy has now decreased. Again, that's not okay. And that's why we're standing up and saying, enough is enough. We're coming together. We're going to push forward to drive not only awareness, but action. So with that, I am actually going to turn it over to my colleague, Dr. Arthur Evans, the CEO of the American Psychological Association. Over to you, Dr. Evans.
Thank you so much, Tracy, and thank you, Clarence, for putting this together, and all my colleagues who are joining us today. You know, psychologists as social and behavioral scientists study the causes and the correlates of health inequities, and both in terms of treatment and in terms of the outcomes that African Americans receive. There are real historical and contemporary factors that have caused the inequities that we see, from the Tuskegee syphilis studies to the more contemporary research that shows how implicit bias impacts on the care that African Americans receive in the healthcare system. The question and challenge for us now is, are we going to allow those historical factors to continue to impact and to exacerbate the inequities that you've heard talk about today in terms of the COVID's impact on the African American community? And we are all saying, as African American CEOs, no. When the vaccine was developed, there was a lot of emphasis on getting the vaccine distributed around the country. But we believe, as the American Psychological Association, that not enough attention has been paid to the human behavior, the human aspects of how this vaccine gets distributed. Yes, there are structural issues, and we have to address those structural issues. And in fact, making sure that the vaccine is in the communities and is physically accessible. But we also know that the vaccine has to be psychologically accessible. And that means that we have to do a much better job of educating people, providing culturally competent, culturally appropriate language and information, so that the diversity that we see in our communities and in our country, that all people have access to that information in a way that makes sense and they understand. As we do this, we have to make sure that we address those structural changes, those structural barriers that I was talking about earlier, making sure that the vaccine is not only in communities, but in places, in communities, in ways that people can have access to them, on transportation routes and so forth. We also have to pay attention to issues like barriers, whether people have the ability to leave their jobs to get the vaccine. We've advocated for example, for employers to look at, can they provide financial incentives, giving people time off to actually access the vaccine. So it's going to take a lot of different factors and a lot of different efforts in order for us to make sure that people get the information that they need and get access to the vaccine. Our position is not that, of course, we want people to take the vaccine, but more importantly, we want people to have the information so that they can make good healthcare decisions for themselves and for their families. So one other point that I'd like to make before I end with some recommendations, some other recommendations. One is that, and we've heard this today, that when the Tuskegee study happened, when other issues have happened where African Americans have not been treated well in the healthcare system, we have a very different healthcare environment today. We have African American scientists, we have African American healthcare professionals, we have African Americans who are in many positions to help evaluate the information that is available. And the reality is that most of us, when we look at the science, when we listen to the scientists and to the medical professionals on this issue, have come to the conclusion that it is in the best interest of the African American community to engage in and to receive the vaccine, particularly given the disproportionate impact. We have to make sure that we are relying on the vast expertise that is in the African American community to provide that information. And so it's very important for African American spokespeople and people who do have that knowledge to step up and to make sure that we're providing that information to the African American community. There are a few things that I would suggest that we need to do. First, it is to make sure that we have physical and psychological access to the vaccine. Secondly, to make sure that we have appropriate and accurate and culturally appropriate information that is available. There is not only a dearth of information often in the community, but there is also intentional, sometimes, misinformation. And we have to do everything that we can to make sure that people have accurate information. We have to make sure that we're using trusted spokespeople from the African American community who are helping to message around this information. And we have to understand that that the African American community is not a monolith, that there is no one solution, there is no one messaging, that there is as much diversity in the African American community as other communities, and that we have to tailor our strategies based on that diversity. This is not an intractable problem. This is something that we can actually make a difference on. And I'm so glad to be here with my colleagues who are stepping up and all of the people that we're seeing around the country who are stepping up, understanding that this is a significant issue and understanding that this is something that we can actually make a difference on. So thank you. And I want to turn it over now to Mark Ott, who is the Executive Director of the City County Management Association. Mark?
Thank you, Dr. Evans, and thank you, Clarence, for bringing us all together today. Again, I am Mark Ott. I am the Executive Director and CEO of ICMA, and I too am honored to be here with my colleagues today to announce the launch of the Vaccine Education Initiative. ICMA has a membership of 12,000 professional city and county managers serving local governments and communities across the globe, including many predominantly Black communities that have been disproportionately harmed by this pandemic. The ongoing risk of the pandemic and increased vaccine hesitancy due to systemic distrust in medical institutions stemming from decades of medical abuse and disinformation targeting communities of color have the capacity to cause significantly more harm to the Black community and all communities of color in the coming months. We at ICMA, we know the power our local leaders have in educating their communities and dispelling disinformation. They are on the front lines of these issues in towns and cities and counties across the country. And they have the firsthand experience needed to work with and educate communities that are experiencing vaccine hesitancy. We encourage our members and all local leaders to leverage our resources and the resources of our partners in this initiative to engage communities of color and ensure equitable access to COVID-19 vaccines. I think I can speak for all of us here today when I say that vaccine hesitancy is a grave concern for each of our organizations, but it is also personal. As Black leaders, we have a platform to speak on this issue, and I believe a responsibility to do so. Each of us has seen the impact of this pandemic in our own lives, with our families or in our communities. And we are driven to do everything that we can to stop it. Vaccines and immunizations are an opportunity for us to prevent further health and financial hardships, especially in communities of color. All of us have a role to play in stopping the spread of disinformation and educating those around us. ICMA will continue to work with local leaders and provide resources, best practices, and training on how to combat the virus and engage Black communities and communities of color in conversations about COVID-19 vaccines. We also encourage Black Americans and people of color to utilize these resources to learn more about the safety of these vaccines. Clarence, back to you.
Thank you very much, Mark, and we do appreciate all of the CEOs who have provided a perspective of information and education to all of the press as well as attendees that are here today. You know, I don't want to also want to just note that we had another colleague, a CEO of the YMCA, who was not able to join us today, but they are as well committed to getting this information out to all of their partners in their movement. And that is Kevin Washington, who is the CEO of the YMCA. So now I'm going to open it up to the press who may have questions. So if you could put your name and put your name in the chat box and raise your hand, and we will respond to any of the questions that you may have. I did have one question in the chat box from Jeannie Bauman from Bloomberg, and that is, what recommendations do the speakers have to make sure that we're not just setting up sites in underserved communities, but that the registration for those sites aren't often flooded with people from nearby, more affluent communities? That these vaccination sites are actually being served to the people that are intended to serve in those areas. And I'm going to start with Joanne to give her a chance to share some thoughts. I participated in an AARP town hall meeting, and one of the things that I think Joanne adding is that rural community focus as well, because we found that a lot of elderly people, especially people of color, really had a challenge accessing from those communities. And then any other CEO would like to add in. Let's just respond. Joanne, why don't you start?
Sure. And thank you for the question from Bloomberg. I think that is so important because we just can't set up these facilities in places where minorities, Black and brown people don't live or have access to. I think that's so important. I think as we've seen cities and towns and states set up their registration sites, they've had to adapt it to multiple different changes that have occurred, that not requiring your address or not requiring a zip code so that you can see what level of people are participating. I know here in the District of Columbia, we had that situation with people who don't live in that community going there to register and actually getting the vaccines. I also think, though, that particularly in rural areas, many times they know their communities better, and they know the local pharmacists at the CVS or the Walgreens. We know also with the Black churches. I've heard this morning that a number of Black churches in North Carolina were actually facilitating the distribution of the vaccine in their church community halls. I think that's so important for local and state governors to be talking to the community partners, the people who know the people in those states the best, and that we need to make sure that the vaccines are being used for the people who it was intended for.
Any additional thoughts? Tracy, I see you unmuted.
No, I completely agree with Joanne. And I think that the linchpin of it all is we have to get in community, and the solve has to be done with community. There is already trust built into community. So whether it is the church or the rec center or the pharmacist or pharmacy, I think far too often these solutions of how to get what is needed into community is developed outside of the community. We got to get in the community and develop it with those folks that live there every single day. And that's where the best solve will come from.
Dr. Evans?
I would just add that in terms of how the information is communicated, there's certain channels that are going to be more likely to reach the communities that you are trying to reach. If you set up these sites and then do a general broadcast of that information to the general public, you're going to increase the likelihood that people not from those communities are going to try to have access in those communities. So I think it's important to understand the community that you're dealing with, and then have communication channels and messaging that is clearly targeting the community that you're trying to reach.
Well, let me, I know we're at time, and let me just say that I truly appreciate the voices that we've lifted up here today, that this is an issue that is going to impact our community for decades and even beyond. I think Tracy hit it on the head that this is personal for many of us. And it's personal because it may be personal because of the decision we made, but also personal because some of us may have lost family members as well. So this is the beginning of a campaign that the CEOs that are on this press call have made a commitment to continue to make that drumbeat throughout America, to say that we first need to get data. We have to get the facts out. We have to get data on who's receiving the vaccine and how they're receiving it. We must improve access to those in those communities that are underserved in our nation. We must recognize that one size does not fit all, and that we need to access the greatest generation as well as the youngest generation, the rural communities and the urban communities. In America, we must commit to making sure that equity is threaded throughout. And so again, we look forward to continuing this drumbeat, continuing this work, because this is important to America. And again, my colleagues, thank you guys so much for what you're doing in your various associations. And we got to continue to do this because there are other issues that we need to talk about in our nation. So I thank you. I thank the press and all of those that attended. You guys have a great day. Thank you.
Everyone.
Thank you.
Clarence?